Hi, I'm Dr. David Warwick, and today's question is, what is causing knee pain? You know, it's really easy that when our knees are hurting, a lot of time we find, even in practice as well as various studies, that we find the problems originating or coming from our lower back, hips, ankles, even our feet. So I want to give a little focus on that, a little history and background where we're coming from on that. First of all, we walk on two legs, so everything's in an upright position, and everything is in what we call a link or a type of kinetic chain that's in our body. One thing, it's almost like a domino effect. One thing in the lower chain, such as the foundation of our feet, all the way up can affect us very negatively. So, for example, if you're flat-footed and or even pronated ankle, where the foot either rolls in or rolls out, causing our knees to kind of what we call knock-kneed bow out, that can produce undue or a certain type of stress. You see that a lot if you look at people when they're walking around, especially in flip-flops. Most of the population has what we call over-pronation, especially by the age of 30, causing our feet to become flatter, not uncommon, especially in kids. This kind of effect can have an effect on soft tissues, the tissues of the knee. This is what generates the pain. This is what you feel from either the overpronation or the inside of the knee or the outer part. We call these the compartments, and they have more load on them. And over time, those compartments, areas of the knees start to wear down, either overpronation or knock-kneed on the side. And front of the knee, there's a cap or a type of groove in there, and as far as overloading in that area, it creates such a condition that we look at called a lateral patellar or patellofemoral pressure syndrome, or chondromalacia patella, what we commonly hear out there, and you can look that up as well. When you come in as a chiropractic patient for an evaluation, a lot of times we're looking at that gait of yours or how you walk or move. The moment we see you coming into the room or leaving the room, we're looking for that overpronation or supination, or what we call genuvarum, which is bow-legged, and valgum, which is more knock-kneed, where the knees come together. Over time, when you beat your knees up, this produces a type of arthritis. And sometimes, and many times, when a chiropractor evaluates, first they adjust the spine, then they can adjust things such as the hip, the knee, even the ankle, the feet, or even add a type of orthotic, foot orthotic, or simply a simple heel wedge into that, into your shoes, to help take that pressure and leave your knees in a better mechanical position. Sometimes people even notice that when they've had knee pain for a long period of time and the chiropractor has started adjusting their spine, that pain went away. Pretty amazing, isn't it? So the next topic we want to talk about is, or just a brief topic I want to talk about, is strengthening, stretching and strengthening a particular muscle that we know predominantly is called the vastus medialis oblique, or sometimes abbreviated the VMO. And that connects to the upper or inner kneecap area on the medial inside of the knee. That area can be simply, counteracts when it's pulled out, especially by the quadriceps. And obviously, to evaluate appropriately, you want your chiropractor to look at certain exercises, isolate that as a problem area on you and knee pain. Obviously, adjusting and getting the knee back in alignment can be a great help to a lot of people that are having knee pain. I hope this little bit of information was helpful to you. I'm Dr. David Warwick, your local Lacey Olympia chiropractor. Also, I have back and neck pain, a relief book that you can look at, and you can either get it by ebook or hard copy. We also have what's called Relief Assist, and that's a muscle ointment to at least block the pain signals and get you through some of the day, especially when you're not able to get in for an adjustment. I'm Dr. David Warwick of Warwick Chiropractic in Lacey, Olympia, Washington. You can go to my website at drdavidwarwick.com, visit my blogs on the page or videos, see how I operate in the office, or give our office a call. I look forward to seeing you. Thank you for listening and watching. See you soon. Take care.